in the last several weeks, but I want to also thank the committee members that we have. We had a very diverse group of committee members who spoke with literally hundreds of business owners and business people across the state. I want to give them special recognition. Senator Chris Elliott from Fairhope, Senator Bobby Singleton, Senator Garland Gudger, Representative Joe Lovern, Representative Anthony Daniels, Representative Kelvin Lawrence, Rosemary Elabash, the State Director of the National Federation of Independent Business, Mindy Hannon with the Restaurant and Hotel Association, Katie Britt, the CEO of the Business Council of Alabama, Rick Brown with the Alabama Retail Association, Tony Cochran of CK Business Solutions, and Stephen McNair of the McNair Historic Preservation in Mobile. These individuals have worked very, very hard to pull together a report that I think is very thorough and provides a roadmap for a safe reopening of our businesses that have been shuttered as a result of the COVID-19. COVID-19 is not unlike anything we've seen in the past. It's had devastating impacts in certain areas of our country, and it's certainly impacted the lives of individuals. But in all across the country, and here in Alabama, this virus is also impacting not only individuals from a health standpoint, but the livelihoods and the financial securities of hundreds of thousands of business owners in the state, businesses, and millions of people in the state. And so I want to read to you I want to provide some data to you that I think is really important, because while we want to protect at all costs the health of our citizens, and that's what this report is doing, there's some things that are just some stark reality. Since March the 16th, over 300,000 Alabamians have filed for unemployment, and that number will increase. We don't really know the financial impact to our state of this shutdown, and we know if it continues, it will just get worse. But you hear numbers bannered around nationwide of 20% sort of being a benchmark. If there were to be a 20% reduction in our state revenue, that would have a $400 million impact to our general fund. And if it were to impact if we had a 20% reduction in our education trust fund, that would be $1.3 billion, which would affect our current and future workforce, the education systems, our economy, and public health. I want to read a quote that was in a study. We looked at several reports and studies as we pulled together this effort, but the Alabama Policy Institute had a quote that I thought was very important and very telling. The quote is this: "It is a difficult time. This is undeniable. It is in these difficult times that the ingenuity of Americans and Alabamians must be harnessed to arrive at a solution that prioritizes human life and the general and social economic welfare." We know there's a mortality rate associated with COVID-19, and we understand the seriousness of that. There's also mortality rates and health impacts from dire financial crisis. And so we're concerned about this, and it's important that we move forward to reopen our economy as safely and as soon as possible. Our committee, as I mentioned, talked to hundreds of business owners across the state, which represented hundreds of thousands of individuals. And in speaking with these small business owners, in their dire circumstances, some of them are already on the verge of bankruptcy, some have filed bankruptcy, some are just waiting to see how long they can survive. In those dire financial circumstances, what came clear to us was, as bad as they wanted to open, they want to open safely. They want to protect their employees, they want to protect their families, their own personal lives, and they certainly don't want to infect anyone else. So what we designed was a process that was a template that we asked all of these business owners and these industries to complete. And the process basically was addressing three things. In your reopening plan, the first thing we want you to tell us is what you are going to do in your reopening to protect your employees. The second thing, what are you going to do in your reopening plan to protect your customers? And third, what are you going to do in your reopening plan to prevent further spread of the virus? Each industry responded. We have detailed recommendations by industry that address those points, and you'll see some common themes in those industries. One, we want to continue social distancing. We realize that's important because we're not through this crisis. We think we're on the backside. We're moving in the right direction, but we still need to be safe and keep that in our mindset as we move forward. So you're going to see social distancing. You're going to see limiting the numbers of people that can be together at one time. You're going to see some very creative solutions and suggestions and recommendations as to how that might be accomplished in these various industries. We also are going to enhance our efforts and focus on hygiene and cleanliness and sanitization in these businesses. And it's something that I think will be detailed and very specific to industries. And these are minimum standards. There may be some industries that maybe decide that they don't, some businesses may say that they don't believe they can implement that, then they will not be able to operate. And some may want to even be more stringent. But the point is, those are paramount to what we're trying to do. There are two challenges that I want to mention, and one is the fact of testing. We understand there's a nationwide shortage of our ability to test, and we want to encourage the Department of Health and be supportive of them in their efforts to continue in testing, to increase testing, and to move as quickly as possible so we can get to rapid testing. And also, one key component to any business safety plan is going to be their personal protective equipment. There's a nationwide shortage of this, and this is certainly going to be a challenge for us, but we do have opportunities in Alabama, and we've identified in our report some of those opportunities. I think the state, the Department of Commerce, the legislature can all work together with some existing Alabama businesses to move forward and address that. But that's key. PP&E is very important. The other thing I want to mention is this is phase one. We're not reopening all of the businesses or recommending reopening all the businesses. We're not. We're doing things that we think can be safely done now. And as we move forward, we'll look to find other businesses and roll those out. I do want to just mention that yesterday afternoon, after we completed our report, as we were proofing it, we received the President's report. And what we're doing fits very nicely and is very consistent with what the President's recommended. So again, I want to thank Lieutenant Governor for his leadership and Governor Ivey and Dr. Harris for the steps they've taken to protect us to this point, and for their support and for their willingness to listen to the business community as we try to move forward on a plan to safely reopen Alabama.
All right, thank you, Representative Garrett, for your work. I want to first talk about, where we were and where we are now. The numbers fell because of the actions the people in Alabama took. When you look at it, 2, 3, 4 weeks ago, our house in Alabama was on fire. If you look at these posters here, you've seen the 20% growth model that I had out there. And we were on track for many days in Alabama, consecutive days, where we were 20, 30%. If you look at that, if you have 20% growth for 30 days, it's 262,000 cases that would occur. If you have 15% growth for 30 days, it's 72,000. 10% growth is 19,000, and 5% growth is 4,600. That's the difference in exponential growth versus linear growth. And what I want you to look at now is these are current cases. If you look back in March, percentage of growth, we were in the 30% growth, some days in the 50s, then in the 20s. The encouraging news is this. The last day of 21% growth was on April 3rd. Since then, we've been in single digits, and 6 of the last 7 days, yesterday was 4% growth. It's not on here. We had to get this made. The encouraging thing is what we've seen in the last few days, and I would say over the last, really since April 3rd, and even before that, that's linear growth. It's not exponential. Exponential growth is what we were worried about and what we saw early on. I want to thank Governor Ivey for her leadership and what she did to stop the exponential growth in Alabama. I want to thank Dr. Harris. He's a good man. We're fortunate to have him in Alabama. And because of his recommendations and his leadership, we're in a spot now, in my opinion, where we can reopen and get our economy going again. We're very fortunate to have him. I want to say this. When you look at, as far as reopening the economy, how do we do that? First, we're going to need Dr. Harris's help. We're going to need Governor Ivey's help. We're going to need the medical community's help. But I want to look at the situation from a standpoint of a business owner right now. The SBA program, the PPP, is out of money. Literally, there's people sending us messages, people that were on our committee, where they could not get money right now, and it ran out. The number of unemployment claims in this state is staggering and at an all-time high. More than 300,000 claims have been filed in the last 30 days. To give you a reference, 130,000 claims were filed in 2019. And so, obviously, this virus is deadly, it's dangerous, but our committee believes there's a way to safely reopen the Alabama economy and get people working responsibly. So I want to talk about our recommendations in just a minute. Before I do that, I want to talk about how this was created. Our subcommittee was tasked with Governor Ivey for safely reopening businesses, restoring commerce, recharging Alabama's economy, while the number one priority is protecting the public health. Small businesses, their owners, and their employees have been hit especially hard by this pandemic. We hear from them every day. But I want to talk about this real quick. You know, it's currently considered safe to go to a box store and buy potentially furniture. It's currently considered safe to go to a box store and buy clothing. It's currently considered safe to go to a box store and even buy jewelry. And our message is simple. The message about social distancing is spreading people out. And the committee says that it's not fair for small businesses to be open and be penalized. And we actually believe that smaller stores mean smaller risk. Why do we say that? We believe that you're spreading people out. And so instead of a lot of people going to one store, now you potentially have, maybe 5 people going in a store to buy clothing. And I think when you look at that from a social distancing standpoint, we believe one of the recommendations we're going to make is in retail, but we believe that smaller stores equal smaller risk. I think, and we'll talk about the restaurants in a minute. I want to say this, when it comes to reopening the economy and putting people back to work, I want everybody in Alabama to understand this. We believe every business is an essential business. And our committee believes that. Each day that our economy stays closed, the ripple effect, goes through our state. So I want to talk about our recommendations that we've sent to the governor. She received them first. I talked to the Governor Ivey this morning and walked her through the recommendations. First recommendation, that we recommend these businesses can safely reopen immediately, which is we believe these businesses can operate now safely. First is retail. And again, we said smaller stores, smaller risk. I'm not going to go through the whole report. It's 155 plus pages, but I'm going to highlight some things, and you'll be able to get a copy of this. It's on our Lieutenant Governor Page's website. It'll also be on Atlas, Alabama. But I want to talk about this. Retail stores. Our recommendation is they ought to be able to operate the same capacity as the big box stores. All right, that's at 50% capacity. Checkout lines need to be clearly marked, just like in the big box stores, where they're practicing social distancing. Because the fight over this virus is not going to end today. It's going to continue. But we believe we can open these stores safely. Doors and exits will have regular sanitation measures, and there's a lot more. That's just to highlight. Restaurants. We believe smaller groups, again, smaller risk. And we believe there's a way to safely open restaurants with limited capacity and proper spacing in Alabama. Our recommendation is, first, customers will have to be seated 6 feet apart. Second, the groups will be limited to 6 guests per table. And third recommendation, and again, there's multiple recommendations. I'm just highlighting a few here now. We're making sure that all surfaces are sanitized regularly. We believe that in restaurants, that's important. And I also believe, I want to say this, is I'm a husband, I've got a wife, great wife, Kendall, 3 kids. I'll feel perfectly safe going in a restaurant and eating. I probably would wear a mask, just like I did in here when I walked in the restaurant until I sat down at the table. But I want the public in Alabama to know that these recommendations we're making, I also think these are safe. Next thing that we recommend that we think are safe to open immediately from our committee is close contact services. As you can probably tell, maybe you can't, my hair is a little bit long. I need a haircut, right? So our recommendations, close contact services deal with barbershops, hair salons, nail salons, tattoo studios, tanning salons, and waxing salons. These services, I think can be done. If the governor and Dr. Harris decided that this would be something they would open, this afternoon or tomorrow, I'd go tomorrow and get a haircut and feel safely. I would probably wear a mask. Now, we have a lot stricter requirements from our committee on this. First, all employees will be required to wear masks. Second, no customers will be allowed in the waiting areas. And third, customers will be served by appointment only. And again, I want to emphasize, these are not the only recommendations. These are just a few we're highlighting to make sure the public is confident. But I think, certainly these can be open in a way where the public can be safe and we can make sure the disease transmission is minimal and hopefully not at all. Next, our final recommendation for businesses we think can open immediately, and I think this directly ties in with unemployment. It directly ties in with people that are already working in essential businesses as well as these businesses that would be open, is child care facilities. And we are recommending to follow the CDC guidelines, obviously with sanitation, and also the CDC guidelines that recommends 11 children in a child care facility. We think that's important. Next recommendations deal with recommendations that our committee decided need to open on May 1st. The first is medical and health services, medical doctors, oral surgery, dental offices, physical therapy clinics, and one that we accidentally omitted that's getting added to our report that you'll get sent is also optometry. Requirements on them, and this, let me say this, we worked with these associations, we worked with these doctors, and I've got a lot of friends. I've got a friend that's a doctor in Guntersville that used to seeing a lot of patients. Now the patients are scared to come in. I've got a friend that's a dentist that had a thriving practice right down the road in Guntersville. Literally, no one can come in, and so I talked to them along with everyone else in our committee, talking with their dentists, talking with the associations to find out, do you think it's possible to safely reopen? These people said yes. So then we said, okay, what would it require to do that? Some of the recommendations were N95 mask, gloves, and facial shields worn by all employees. These are for dental recommendations here that I'm going to go over. I'm not going to go over every single thing in health service. These are dental recommendations. All surfaces be regularly sanitized. And again, no patients will be allowed in the waiting room. If you go to a dentist's office, you'll pull up, you'll wait in your car until it's your time to go to your chair, and that obviously notify you to come in then. We think that working with these industries, that obviously doctors, these providers know what's best, and we think a May 1st recommendation is what they recommended. Next, entertainment venues. These are racetracks, casinos, bingo halls, museums, planetariums. This would first, it would deal with a 35% capacity issue on some of these, taking temperatures of employees before allowing them in the facility, maintaining a distance of 6 foot in between each patron, regularly sanitizing high-touch areas. We think those are important. Exercise facilities, another May 1st recommendation. They already have a sanitation system in place, but it needs to be upgraded, and it's got to be even more thorough now. The spreading of equipment to make sure proper social distancing is going on. Regular sanitizing of equipment and contact services, and limiting the interaction between employees and gym members. Next issue is the beaches. I know a lot of people have heard about that. Our recommendation on that is twofold, and we worked with the leaders in Baldwin County. We worked with the Mayor Kraft. We worked with Mayor Kean. We worked with Sheriff Hoss Mack. Worked with Senator Chris Elliott on getting these measures in place. But let me say this, I think it's important, and I think from my standpoint, there's a way to safely do this. So the recommendation is this: May 1st, beaches will be open to recreational activities such as walking, running, fishing. Now, this is a model that they use in Hawaii right now, and it seems to be working well, where people are on the beach, potentially exercising, walking. You have to still practice social distancing, but it allows people to go to the beach. It allows our state to make sure we get the revenue. We think that can be done in a safe manner. On May 15th, if you look at the group over the poster there, it's going to expand. So if my family went to the beach and we stayed in a condo or a house and we actually wanted to go to the beach, then we would be allowed to actually, be in a chair, have a tent, but only with our group. And so if you look there, smaller group, smaller risk, the recommendation is going to be 10 or less, and only with people you're staying with, or if you're a resident of Baldwin County or you drive down from the date, people you live with is the recommendation there. So the idea is you'd be on the beach with your group you're staying with, and in my opinion, with my family, with Kendall and my kids, whether I'm in Gunnersville practicing social distancing or whether I'm at the beach practicing social distancing, we still have to stay 6 feet away from any other groups or people when we're in our group. But the recommendation is you're not allowed to have more than 10. That would go into effect May 10th. Now, people ask, how are you going to enforce this? Great question, and something that we worked with. We worked with the mayor, both mayors in the cities, as well as the sheriff, and there's a plan in place to have patrol similar to like what you see, beefed up patrol at spring break, to make sure that people are practicing social distancing. My belief is the people of Alabama, for the most part, are going to follow the guidelines and do what we ask. However, we want to make sure we have patrol there, and we're going to do that. One other thing is we've heard a lot of different issues about sports, different things. There's one recommendation we had dealing with youth baseball and youth softball, and this is a later recommendation, May 11th. It came from some national, there are several national associations as well as states. There's some that thought you might could do it earlier. There's a lot of stringent requirements, and each league has different things. Some of the things, no public concession stands. All the fans are going to have to practice social distancing. Kids wearing masks when they're in dugouts. Those are some of the things. But I think when you look at our kids and giving them hope, and our national pastime this summer, youth baseball is something that could certainly give us hope, and as well as potentially other sports that can maybe be done safely. But baseball being outside, we think there's a way to safely do that, and there's already a lot of national as well as state organizations that submitted some good plans, and so we submitted that. We also had some industries in our report that recommended best practices. They're already open, but they also wanted some guidance and maybe some recommendations. And so we submitted those as well: pharmacy, real estate, manufacturing industry, and agriculture. And final thing is, you talk about PPE, right? And that's a big issue. One of the most encouraging visits I've had, this last week I got to go to Coleman and tour a plant. And they're looking at producing medical grade face masks right here in Alabama. They could basically produce 300 to 400 million. And so when you look at this, a PPE, one of the things that the governor's been working on, doing a great job with Secretary Canfield, is to try to get manufacturers in Alabama to produce PPE. That's a great example. We're going to continue to push that to make sure that in this new normal, right, we've got to get the economy back going, that we have safeguards in place. So that is our report, and be glad to take any questions that you have for myself or Representative Garrett. Yes, sir.
Is there any concern, what do you say to people who may be concerned with going to some of these businesses once they open up, even though there's no vaccine for this virus?
Yeah, I would say that you don't have to go, right? I mean, if you think the safety protocol is not what you want, or if you're, potentially at risk, or, have any type of the virus potentially causing any type death, we say don't go. And so it's optional. All we're saying is let's give the business owner a chance to actually make a living, the same standards that some of these big box stores and other places have. And I think we can do that safely. Lydia.
How would, we talked about beaches being enforced, but thousands of restaurants, thousands of facilities, businesses, retail stores, how will that sanitation, the social distancing, those efforts be enforced on that standpoint by law enforcement?
Yeah, you can take that one.
Well, I think a couple of things. One, if you're going to have in-service restaurants, you're going to have to abide by these standards. So that's going to limit the number of people that can actually go inside a restaurant. You'll be limited to the number of people that can stand outside the restaurant in the waiting area. During this time, the restaurant industry has been very creative with the curbside, the pickup. I think those things will continue. So the fact is there'll be a limited number of people, and I think more people now will not be so concerned about going inside. They will have to choose another option.
So how would that be enforced? I mean, would law enforcement be
Yeah.
really involved here to make sure that those practices are being followed on the retail standpoint, on the restaurant standpoint? Talk about that, or are you really
I
going to
think-
rely on people to actually follow those?
Well, I
guidelines?
think there's several tiers of this. Number one, we make these recommendations to the governor and to Dr. Harris. So the Department of Health will certainly have its say on how things are regulated. Also, each of these associations will be expected to enforce the guidance of their members, and then certainly law enforcement will be keeping an eye out. So I think there'll be multiple areas of check. Another thing I think is other people. I mean, I think you're saying everybody here, I've been in situations where somebody comes to me, I just hold my hand and say, stop, you're getting too close. There's 6 feet there. Some people are going to have to understand that. So I think people who are going to see violations, we encourage in this report, if you see a violation or somebody not adhering to standards, report that. So I think it's a combination of all of that.
Yeah, Lydia, I'll say one thing real quick to that too. I think when you looked at currently what's going on and the compliance we've had just from the restaurant industry, to your point, it's been great. I mean, I think the people of Alabama have respected the governor's order when it comes to restaurants. And the restaurants have done a good job of adapting. I think they'll do the same thing with this order. Todd.
You've shown a lot of data here. You've obviously based a lot of this off of the data. There's concern about a resurgence, in the fall or in the future. Is there anything in this report, I haven't read the whole thing yet, is there anything in this report that would say if we do see an uptick, some kind of variations to the report or to the recommendations? Has that been considered at all?
So I think, Todd, when you're looking at this going forward, I think if you talk to healthcare professionals, the way you monitor this stuff going forward is get our testing capacity up, and it's a test, trace, quarantine model where you go in and you don't necessarily shut down a business just because they have somebody who's positive, but you go in and you test the person that's positive and the people around them, and you find out who's actually positive in that business. And then, you sanitize the business, and the people that are positive, that day, right? And so they go out, they get quarantined, and then you have public health that's doing tracebacks. Anybody, those people that test positive have been around outside of that business, they go test them. I think that's how you manage this going forward. You don't shut down the business, but you use the model of a test, trace, quarantine. Obviously, our testing capacity's got to continue to go up. It is. And I think, it's been encouraging, but I think that's how you manage this going forward.
I guess what I mean is if those numbers that have been improving suddenly start to, deteriorate and get worse, would you then recommend backing some of this up?
Yeah, I think what we'll do is try to find out where the spread is occurring and eliminate the spread. Absolutely. I think the situation we were in before is, you couldn't pinpoint it. It was just growing everywhere. And so, the goal now is to try to do that through testing. I think that's the advantage we have now. So,
the reopenings you said that you think could happen now, such as the small retail and the restaurants, the governor's orders in place until April 30th. Are you expecting her to amend that before then, or when you say reopen now, are you talking about after April 30th?
We'd like for the governor to open those now and consider those, even amend her order to make them essential, or to potentially look at the data. If you look at it, we've had the president, if you looked at his guidelines, that came out yesterday, is 14 days of, growth going down. Assuming if we have another percentage decrease today will be 14 days of percentage growth from April 3rd at 21. So, we're giving her recommendations on a narrow thing, and we'll let her make the decision.
Well, when you talked with the governor this morning, what was her response, especially when it came to those small retail stores, when you're saying, hey, let's open those now, when the governor told me she kind of alluded to wanting to wait for all of the other 2-3 committees to kind of bring back their recommendations?
Yeah, so we talked to the governor this morning, sent her the report, and she's reviewing it. Obviously, it's a big report, 155 pages, but she was very encouraged, very thankful to everyone. The governor loves the business in Alabama, and I think her desire is to protect people and also make sure our businesses are thriving. And so she's going to review it, and I'm sure make her recommendations.
Mr. Lieutenant Governor, could this group come back and make some recommendations for schools opening up, whether it be summer or fall, or would you leave that up to the Department of Education?
Yeah, so what we're focused on is small business. That's what this task force is. Now, we will continue to work. There's other small businesses that are impacted that we're going to continue to look at, and maybe later on might be appropriate to make different guidelines and recommendations. So this task force will stay together and continue to do work and continue to make recommendations, but not about school. That's not in our wheelhouse and not what we've been tasked to do. Yeah.
Are you concerned with the workforce inside of a small business? One person is infected, it gets passed to employees. Then what happens to the workforce of that business if a lower percentage of their employees are required to quarantine?
Sure, yeah. I mean, I think that's certainly something that, small businesses are going to have to adapt to. And it'll probably be some times where they'll have to adjust what they're doing based on that. But, these are all uncharted territories. And, I just think what we heard consistently from business owners is give us a chance. Allow us to safely do what other businesses are already doing in this state. And I would argue that these businesses have been open. They're operating right now, essential businesses, and we're seeing the spread go down from a percentage daily growth standpoint. Now, those challenges will be up to each business to handle on their own, but I'm confident they can do that.
Can I respond?
Yeah, go ahead.
Yeah, I just want to say, too, I think we have a little bit difference now that we have some experience behind us. When this order first came down, it was new. And so the retailers that were allowed to open were having to learn about social distancing and how to manage that, how to manage store capacities. And then just in the most recent order, that capacity was limited. Well, now, as we start up these businesses, we have the benefit of what we've learned altogether, and they're starting with a very strict set of guidelines that I think will help in that regard.
All right, we'll take one more question. Lydia.
Can you do you have a couple businesses that are not allowed to open that you have not listed? What types of businesses or venues will just not be allowed to open in your recommendations?
Sure, yeah. I think when you look at right now, movie theaters, any type concerts, I have a business that's a trade show, any type large gatherings, right? We don't think it's wise to open that based on the experts we've talked, just because of the risk of a lot of people getting spread. So these businesses, though, we felt good about from the small business. They could be open safely in a way. And look, I want to say this, make sure people out there understand, this isn't going to be a perfect plan. We're learning together. We need everybody to work together to continue to improve this. But we've got to get our economy going and do it in a safe way. So thank you so much.
Can I respond? Just one quick. We've already been asked this question to clarify, but if bars are not included in this, we're talking about restaurants, so not bars.
All right, fantastic. Thank you.
Does anybody need a copy of the press release before I leave? I'll wash my hands before I touch them, I promise.
Do you know where we can get that report? I didn't see
It's on
it
our
in the
website.
email. It is on your website.
Yes.
Thank you.
On our website, atlasalabama.gov.